Are you getting enough sleep? It might not seem like a big deal, but skimping on shut-eye can have serious consequences for your health. In fact, studies have shown that sleep deprivation is linked to conditions such as hypertension, coronary heart disease, and diabetes mellitus. And it's not just the quantity of sleep that matters, the quality of your sleep is important too. Factors like sleep apnea syndrome can also impact your health. So it's time to reevaluate your sleep habits and make sure you're getting the rest you need. But what is it about sleep deprivation that puts us at risk? It's believed that it activates the sympathetic nervous system, which can contribute to the development of hypertension and diabetes. Ensuring sufficient sleep may be crucial for preventing cardiovascular diseases in modern society. Are you sacrificing your sleep for productivity? You might want to reconsider, because a lack of sleep could have serious consequences for your blood pressure and your overall health. Hypertension, or high blood pressure, is a common health issue that has been on the rise in recent years, despite improvements in awareness, treatment, and control of the disease. Interestingly, this increase has coincided with a decline in average sleep duration in the United States. One study looked at the link between sleep duration and hypertension in a group of 4,810 people between the ages of 25 and 74 over a period of 8 to 10 years. They found that those who slept 5 hours or less per night had a significantly increased risk of developing hypertension, particularly in those between the ages of 32 and 59. So, what is it about sleep deprivation that raises our risk of hypertension? It's thought that it may be related to autonomic dysregulation, which changes the balance of the sympathetic and parasympathetic nervous systems during sleep, leading to increased sympathetic tone. In other words, sleep deprivation may increase activity in the sympathetic nervous system, which can raise blood pressure. Other research has also supported this idea, showing that blood pressure tends to increase the day after sleep deprivation in both normal and hypertensive individuals. In addition, studies have found that sleep deprivation can lead to increases in heart rate, circulating levels of norepinephrine and epinephrine, and inflammatory responses that may contribute to the development of hypertension. We know that getting enough sleep is important for our overall health, but did you know that a lack of sleep could also increase your risk of coronary heart disease? That's right, research has shown that short sleep duration can lead to an increase in sympathetic nervous system activity and blood pressure, which can have negative consequences for cardiovascular health. But it's not just a lack of sleep that can be harmful, getting too much sleep may also increase your risk of coronary heart disease. Studies have found that both short and long sleep duration are independently associated with an increased likelihood of coronary events, suggesting a U-shaped relationship between sleep and this serious health condition. So what might be the cause of this link? It's possible that factors such as hypertension and increased sympathetic nervous system activity may be involved. Sleep deprivation has also been shown to increase heart rate, vasoconstriction, and salt retention, all of which may contribute to hypertension and increased risk of coronary heart disease. On the other hand, the relationship between long sleep duration and coronary heart disease is not well understood. Some researchers have suggested that sleep apnea syndrome may be a contributing factor, but more research is needed to confirm this connection. In any case, it's clear that maintaining healthy sleep habits is crucial for protecting your heart health. So make sure you're getting enough, but not too much sleep to keep your risk of coronary heart disease in check. Okay. We discussed the potential negative correlations between sleep to hypertension, as well as sleep to coronary heart disease, but did you know that a lack of sleep could also increase your risk of developing diabetes? Yep. Science says it's true. So why might this be the case? It's thought that sleep deprivation can disrupt the body's natural hormonal balance, leading to an increase in cortisol levels and insulin resistance. It's also been suggested that a lack of sleep can lead to reduced testosterone levels, which have been linked to obesity, high insulin and glucose levels, and an increased risk of diabetes. On the other hand, the relationship between long sleep duration and diabetes is not as well understood. Some researchers believe that sleep-disordered breathing, a known cause of daytime sleepiness, may be linked to increased sympathetic tone and glucose intolerance. Overall, it's clear that maintaining healthy sleep habits is crucial for protecting against the development of diabetes. So make sure you're getting enough, but not too much sleep to keep your risk in check. To conclude, don't ignore your sleep habits. Make sure to prioritize healthy sleep and consider factors like sleep quality and sleep apnea syndrome. Your body will thank you.